Welcome back to my YouTube channel. My name is Livina. I will be your instructor for today. Today we're going to talk about ambulation. And what is ambulation? Ambulation is the ability to walk, move about freely, and one of the goals for a patient after surgery or an illness is to be able to walk freely. And in order to reach a patient's goal of ambulation, they may require assistance before they are able to walk around on their own. As a CNA, one of your responsibilities is to help this patient to achieve this goal. For ambulation to take place, there are some of the ambulatory assistive devices that we might use, and one of them is walker, cane, crutches, wheelchair, motorized scooters, and gait belt. In your skill, you are asked to ambulate a resident using a gait belt. So we will emphasize on the gait belt. Now, the purpose of a gait belt or transfer belt is to assist and support unsteady resident when transferring or walking. So which of your patients do you use gait belt when assisting them to get out of bed? Is it steady or unsteady patient? I hope you'll be able to answer this question. The answer is unsteady patient. Now, if you have watched the video on ambulation, you will know that before you ambulate your patient, remember to put the non-skid shoe on your resident. Now, if you check on your clinical skill test checklist, if you don't have this, it is on Prometrics website. So if you check on the ambulation tab, which is ambulate the resident using a gait belt, if you check on number 3, it says, okay, let me make sure you got it. Okay. It says apply transfer gait belt before standing resident, placing around the resident waist and over clothing, secure so that only flat fingers and hand fit under belt and the belt does not catch skin or skin folds. So when you are performing this skill, you need to know this is critical. Gait belt should be applied before standing this patient. All right? Now, the question is, why do you put gait belt around the patient's waist? Well, can you answer that question? Well, I can give you the answer. It's to provide a way to hold onto the resident. Now, let's read number 4 and 5. Number 4 says, provide signal or cue to resident before assisting to stand. Do you want to put gait belt and just get that person up without telling the person to get ready? No. You want to make sure you tell the person that you are getting him ready to get up. And how do we say that? Miss Jones, at the count of 3, we're going to get up, okay? 1, 2, 3. Now, number 5 says, assist resident to stand while holding onto the transfer belt without holding belts, only at the front or at the nearest side, if assisting to stand from the side. Right, you want to hold that belt. without holding only at the front. So you want to hold it one on the front and then at the back. Remember, you are using this way to hold on the resident. All right, so number 6 of this checklist, you say, ask about how resident feels upon standing. Remember, some of these patients, maybe that's the first time for that day she's walking. You want to make sure the person is not feeling headache, no dizziness while you're getting him up to ambulate him or her. So now the question is, what will you do if patient tells you that she feels dizzy or has pain when you get her up to walk her on the hallway? I hope also you will get this answer right. But then, if the patient tells you that she feels dizzy, headache, what you need to do is what? Let that patient sit down and then you notify the nurse. That's all. What if the patient begins to fall? What will you do? Are you gonna hold that person too tight so that he won't fall? Now, assist that patient to the floor. The word assist, you are making sure that this patient is not gonna fall hard on the floor. You are making sure that you are protecting this patient from hitting his head on the floor. You assist them to the floor. What if your patient falls? What will you do? Well, sit with the patient and call for help. All right? So, again, let's see number 7. Walk resident while standing to the side and slightly behind resident. You're gonna stay in the front and the patient is at the back? Or you're at the back and the patient is on the front? No. Okay, number 8, provide support while walking resident with an arm around resident back, holding transfer gait belt. Ask about how resident feels during ambulation. Again, if the patient complains of pain, headache, dizziness, you want to stop and report to the nurse. Walk resident at least 10 steps. That is item number 10. Now, when you get your patient up, you want to tell Miss Jones, okay, Miss Jones, we're going to walk 10 steps forward, then we'll come back, okay? Yes, you want to mention that you're going to walk your patient 10 steps forward and then back to the seat. Now, assist the resident to turn and have back of legs positioned against the seat of chair before resident sits. This one is critical. When you walk the patient back to his or her chair, you want to make sure that the back of his or her legs is positioned against the seat of that chair. If not, the person might sit, when the person is trying to sit on that chair, he might fall because he's not close to that chair. This is critical also during your skill performance, okay? Number 11 says, number 12, provide support to sit resident back into the chair. Do you want to let the patient say, oh, Miss Jens, we are back. Okay, sit on your chair. No, you still want to support that patient to do so. Remove transfer gait belt without harming residents. Critical. And while you are doing all this, remember, you want to protect your own body. Maintain your own body maintenance while assisting residents to stand and sit. Now let's look at this question. When you are walking your patient with left-sided weakness, you should assist the patient on which side of the body, left or right. The patient has left-sided weakness, so you should assist that patient on the left side. I hope you enjoyed these little explanations on ambulation. If you do, please subscribe and hit the notification button. Thanks for watching, and God bless you. Thank you.